Hi, I'm Bill Wilt of Assured Research. Thanks so much for joining this quick hit video where we're going to focus on one topic drawn from our July 2024 Assured briefing. If you're a subscriber and watching, I'll say thank you for your interest and hope you enjoy the content, get value from it. If you're not a subscriber but you enjoy this and our other content at the YouTube site and on LinkedIn, please feel free to reach out. We'd be happy to start you on a trial. So if you bear with me while I just share my screen, we will jump right into it. We're going to talk about the national healthcare expenditures. Each year, and here we go. Each year, the Office of the Actuary at the Centers for Medicare and Medicaid Services produces a 10-year forecast of our nation's healthcare expenditures. In 2023, get to this slide. In 2023, they were about $4.8 trillion, or 17.6% of GDP. They're forecasted to rise over the next 10 years to become 19.7%, nearly 20% of our nation's GDP consumed or going toward healthcare expenditures. The left-hand side, if that just big picture, it'd be useful to understand what the expenses are and who's paying for them. On the left-hand side, it shows the pie chart of the 2023 expenditures of 4.8 trillion. Hospital and physician care sum to about 50%, with the other categories that you see there. And on the right-hand side, it asks the question, who's paying for these? Of course, we as individuals are ultimately and taxpayers, but the payers to the healthcare providers are private health insurance, Medicare, Medicaid, some to about 70%. When you add in the green there, the out-of-pocket expenses, you get to about 80% is paid from those payers. We've always estimated that property casualty insurers pay through workers' comp, through the bodily injury component, that our payments into the healthcare system constitute well less than 5% of the total. So we think, although medical payments are clearly very important to our industry, they're still only a very small component of total healthcare expenditures. Useful to consider on the left-hand side here, the major components of healthcare spending, and that we picked the components most pertinent to property casualty insurers, and the 10-year forecast. Well, the 10-year forecast for hospital care, physician care, prescription drugs, etc., durable medical equipment, kind of all in the 5 to 6% range. Those numbers at the top tell you what percentage they were from that pie chart that we saw in the last slide. So kind of everything's in the 5 to 6% range in terms of total healthcare expenditures on a compound average growth rate over the next 10 years. That's the current forecast. The standout there is home health care services. That nears 8%, largely attributable, we suspect, to, over the next decade, a really rapid rise in the age cohort of those over the age of 65, at least compared to the total population growth. The right-hand slide here, we're looking at national healthcare expenditures. The forecast, draw your attention to the three bars on the right-hand side, which represent the 2022, 2023, and 2024 projections by the CMS. Now, remember that healthcare expenditures, which is the those categories we're analyzing and looking at the growth rates, they change for three things. For three reasons. They grow for three reasons. One is the population grows. It's forecasted to grow at about 0.6%, and that hasn't changed much. So the expenditures grow with inflation, medical inflation, and here is some good news. Medical inflation isn't forecasted to differ or change much over the next decade, coming in at something a bit less than 3%. And then healthcare expenditures grow with utilization mix, changes in the services provided, the mix changes, and so forth. That's forecasted to be just under 2%. So look, summarizing, what we'd say is that medical inflation, of course, matters. The CMS forecasts it to be around, let's call it 3%. We've always been a bit more bearish than the CMS. We think that there could be meaningful supply-demand imbalances in the decade ahead that could force the hand of or force inflationary pressures higher. Realize that property casualty insurers have some way to combat that, but we'd suggest that big picture, you keep in mind that property casualty insurers are well less, we think, than 5% of total healthcare revenues. So it's not clear that we can, have a lot of bargaining power or can repeal the laws of supply and demand. Hope you found this useful, and thanks so much for your interest.